All right now. Guess what? We're talking about cleanse part two on tonight. I'm Dr. Ace from the Metro Detroit area. Yes, I am a medical doctor. Family practitioner, as they call them, family practice is my area of specialty. But I do love natural remedies and alternative medicines. So we're simultaneously broadcasting on Facebook Live and YouTube simultaneously. So it's a beautiful day outside. I'm telling you. Let me see if I can. Um, yeah, trying to get rid of that all that lighting that's back there. Yeah. Hey, Renithia. Thank you for joining on. Please like and invite and share. Hey, Essie, my BFF. How are you? Um, Thank you for joining on tonight. Please, as you come on, sharing is caring. Please share the broadcast on tonight. We're going to be talking about cleanse part two. This is part two of the cleanse. We had started talking about it 2 Mondays ago, and then I was going to do part two, but I forgot I had a guest scheduled for last week. Hopefully, you enjoyed the guest that we had last week, Maritza. Hey, Maritza from Houston, Texas. So we had a wonderful time. She gave us a lot of good tidbits. Hey, Marvin, thank you for joining on. Please like, invite, and share. Please come on as you guys come on. We're going to be talking about detox part two. Hey, Brother Green, thank you for joining on. Please like, invite, and share as you guys come on, caring and sharing. Please, yes, we want to get this information out. Hey, Miss Mazine Robinson. Yes, come on, please like, invite, and share. We're going to be talking. Oh, blessings to you also, Marvin. We're going to be talking about detox tonight. Yes, I've been doing a detox these last couple of weeks, and I feel like a teenager. See that? I got some breakouts. Remember, told you guys where you detox, so I need to up my water. But it's really a challenge for me. So be praying for me. It's a challenge because I go house to house and I don't like using everybody's bathroom. So I have to monitor my water. And then when I get in at night, I try to ante up and drink more water, but it's working out, it's balancing out. So I'm really excited about how things are turning out in my life in regards to my health. I think I am now, um, you know, staying focused and making sure that I am being an example. I'm just not just sharing this information with you guys and not doing it myself. So hopefully you guys are getting some good information and then applying it to your life. Yes, because we're talking about lifestyle changes, something that you're going to do the rest of your life, not just what I call hit a lick and then go back to your old ways, and then it's like this vicious cycle. So please, I know it's a beautiful day here in Michigan. I thought it was supposed to be some thunderstorms, so it was kind of funny. I had my rain boots on, my raincoat. Then somebody told me, no, it's supposed to thunderstorm at night. I'm like, okay, all right. I have a Alexa, and I was like, Alexa, what is the weather going to be like? And she told me showers and thunderstorms. So I don't know about that, but anyway, so please, as you guys come on, please like, invite, and share as you come on, because we're going to be talking about detox part two. And I think we left off, I think the last time we left off, I think we talked about the benefits of cleansing. Um, yeah, I'm going to start there. I think we talked about colon cleanse, the benefits of colon cleanse. I think that's where I start. I think I did, I should have marked it off where I stopped off. Any of you that was on 2 weeks, hey Doris, do you guys remember where I left off? I don't remember. I think I did colon cleanse, the benefits of it or whatever. But anyway, it's 8:05. I'm gonna give you guys a little bit more to pile on. Please like, invite, and share as you guys come on. Again, I am Dr. Grace Patterson from the Metro Detroit area, managing owner of Bethesda Holistic Center, Everything New. We do home visits. We bring the doctor's office to the sick, disabled, and shut-in and seniors, and those that find it a taxing effort to get out and get to the doctor in the Metro Detroit area. We also provide concierge services, which is tailor-made healthcare to whomever, but primarily to the business professional. Hey, Brandy, thank you for joining on. Please like, invite, and share. And we are a physician beyond borders, so we can do consultations. I don't care where you are, due to modern technology now. We can, especially the alternative piece, we can definitely get with you and come up with a tailor-made health plan. Not talking about insurance, but a tailor-made health plan, as we talked about how it's important for you to have a health plan that's tailor-made for you. Hey, Apple of God's Eye Baylor, thank you for joining on. Please like, invite, and share as you come on. Caring is sharing, or sharing is caring. We're talking about the services that we provided with us, the Holistic Center. We do a myriad of things. I'm going to talk about this for a minute before we go into detox. We do a myriad of things naturally. I'm going to be doing a talk real soon on all natural pain management, where all the pain management services that we provide, that we can provide, is all natural. I do have a pain management clinic that we do, and everyone that are on opiates or some type of narcotics, are they, once they come on board, they agree to be weaned. So we're doing a lot of natural things with them, and we're having tremendous success. Hey, Cornell, and we also added a natural product that is made of 12 plants that has been doing amazing things. We actually do it as an infusion, IM injection, topical, and a oral supplement. So I'm really going to do a whole show about that. Hey, Jacqueline, thank you for joining on. So I'm really excited about that, because with this opioid epidemic, it has really hit the African American community in such a way that no one is really talking about. But it is an epidemic since it has crossed racial lines. If you hear what I'm saying. So, but I'm gonna do a show on that, and then another show that I'm gonna do about. If you guys let me know, because I've been asking you guys to send me. You look nice in that scrub uniform. Oh, thank you, thank you so much. I appreciate that. I actually worked in this today. So, but anyway, we're gonna also do a show about. We will soon be providing a test that can tell you what's going on with your brain. You know, on what's going on with, Alzheimer's disease, vascular dementia, or what we call vascular dementia, or Alzheimer's dementia. There is a test that's out there that can tell you what's going on with your brain now. You don't want to you don't want to get to the point where things are so bad, and it's like a person gets a diagnosis of dementia or vascular dementia, stroke dementia, or Alzheimer's dementia. We are going to do a show about that, and I want to know, and it's going to be a test, and of course insurance companies don't pay for it because it's a natural thing. And I want to, after I do the show, I want to get you guys consensus on what you will be willing to pay for this test, to tell you where your brain is right now, and if there's any deficiencies, how we can supplement it to prevent you from, for anyone from going down that loss of memory dementia road. Okay, so I'm really really excited about that. So what time is it now? Oh yeah, so we also do platelet replacement therapy, and you guys like, what is that? I did a whole show on that, so you guys can go to YouTube, Medical Monday, YouTube, Grace Patterson, because there is another Medical Monday out there, but it's not me. But Medical Monday, you can, and I have a myriad of videos there. So from about platelet replacement therapy, which is a step under of stem replacement, stem cells. I'm quite sure you guys heard about that, which is very controversial, which is not legal in the United States. But it is just taking your blood from yourself, from you. We spin it down and we take the platelets and inject it back into you. And the cell is what we call a naked cell. So wherever area we inject it, it communicates with those cells and say, hey, what are you doing? And then it might say, hey, I need some hair right here. So we also do it for a hair replacement treatment. Or we might inject it in the knee, and then when the cells go in there and they say, hey, what are you doing in here? And then the cells say, hey, we need some cartilage in here. Could you help us make some cartilage? So it helps the body rejuvenate itself. So that's the four areas that we really hone in on at Bethesda Holistic Center. also known as Everything New. Hey, Sister Frederico Mobley and Dion, thank you for joining on. And when we put those cells back in, it helps rejuvenate the body. So that's platelet replacement therapy. The four areas that we are really honing in on the alternative side is anti-aging, sports performance, weight wellness, and energy, because most people come to see the doctor for like, hey, and number five, pain management, natural pain management. So it's five. It's kind of funny. Five for grace. Yeah, so five areas that we really focus in on. So so rejuvenation of those cells. So Dion, it's good that you came on because we're talking about platelet replacement therapy, how we take blood from a person and give it back to a person in a certain area so it can regenerate and rejuvenate cells. And then we also talked about a test that we're going to be offering real soon based upon the interest. So if we have a lot of you out there in Medical Monday world who's interested in finding out where your brain is right now. Hey Linda, thank you for joining on. Please like, invite, and share when you come on because sharing is caring. We're talking about the five areas that Bethesda Holistic Center focus in on: anti-aging, sports performance, weight management or weight wellness, energy, and pain management. As far as the concierge or alternative side is, we also believe here at Bethesda Holistic Center there's all what we call allopathic medicine and alternative medicine. Allopathic medicine is traditional medicine, pharmaceuticals. I do believe there's a place and a role for that. Um, and then I also do believe that you can use some alternative modalities, and there should be no reason why they should not work synergistically. And let me give you an example. Example being, let's use Lasix for example, a water pill that helps diurese a person that may have congestive heart failure to get the fluid off or manage the blood pressure. It can cause potassium depletion. Hey Janice, thank you for joining on. Please like, invite, and share. So a person that's on Lasix, they probably would need potassium. So if a person is on hydrochlorothiazide, which is also a water pill, they may experience muscle cramping. That is a classic sign of potassium deficiency. So for every medication a person takes, there is a depletion in the body. Let me say that again. For every pharmaceutical medication that a person takes, there is a depletion in the body. And so at Bethesda Holistic Center, what we do, we make sure when we prescribe those medications, especially if they're on something long term, we actually supplement what their body needs. So my diabetics are on a certain regimen because I know their insulin, their metformin, or whatever the case they may be on, if they're not doing it totally naturally, we have them on this combination to help them with that and also at the same time manage their diabetes. Or manage the diabetes. I don't like to give ownership to disease to anyone, so please forgive me for that slip of words. For the diagnosis of diabetes, a person that may have hypertension on certain type of medications, we also make sure that they're supplemented on that. Some people that are on anti-inflammatories chronically for a long time, maybe even a steroid, we make sure that they are supplemented with calcium because steroids can thin the bones. Yes. So we make sure that they're on some type of calcium supplement. So those are the type of things that we do at Bethesda Holistic Center. Believe me, guys, if your doctor is not doing this, it's not because they're being mean or withholding treatment. It's just that we're not trained that way. We're not trained that way in medical school or in residency on the allopathic or the natural side or the supplement side. We're just not. So most of the things that I'm sharing with you is number one, either from my personal experience, because I want to be healthy. I want to live a long time. So I do a lot of reading on what I need to do naturally, especially your food should be your medicine, number one. And then number two, I've been to different courses and different classes and been certified in certain areas and things of that nature so I can share this information with you. So today we're going to talk about cleanse part two. I think where we left off at, I'm going to get into that right now. Please invite some friends on this. Dr. Amanda Upchurch, thank you for joining on. Please share with your friends and family. Oh, the broadcast on tonight. So the last thing that we left off on, if I do remember, we left off on colon cleanse, the benefits of colon cleansing. There is different what type of things that you can do to colon cleanse. There is some things. I remember doing a show, and I don't know if the video is on YouTube, but I did a show. Thank you for sharing. I did a show on natural remedies in your kitchen cabinet. I actually went in my kitchen and brought out all the different spices and explained what they could do and all that other kind of stuff. So colon cleansing, you can also use some things that you have in your cabinet too. So from a natural perspective, there's things on the market that you can buy, but you got to be careful. A lot of supplements and vitamin stores and things of that nature, they have what we call vendors that will come in and provide their product. They are not FDA regulated. That's Food Drug Administration regulated. So I try to make sure anything that we provide at Bethesda has some type of certification or some type of FDA regulation, or like for example, our sports performance is what we call sports certified. And you're like, great, Dr. Grace, I know I'm going down the street around the corner, but follow me here. It's sports certified, which means that there is a team that actually goes into they test the product to make sure, number one, what's in the product on the label is in the product. Because there's a lot of supplements out there that claim to have certain things in them, and they don't have, and it's not true. And being that they're not regulated, they get away with it. So, and then they actually go into the factory or to the place where it's being manufactured to make sure that it's the highest quality, that it is sterile, and that to make sure that there's no cross contamination. Because people that perform or in sports, especially athletes, they have to be very careful to make sure that they don't get certain supplements in their body that can be misconstrued as a sports enhancement. So there's a lot of natural products that can be considered sports enhancement. But anyway, we try to make sure that the products that we recommend or provide through Bethesda Holistic Center are the highest quality. And I make sure of that. And guess what, guys? Most oftentimes I'm on them myself. So I'm a walking billboard for anything that I recommend. So anyway, let's get back to the colon cleanse. You got to make sure that you have a good product, and make sure you read the filler section, because some they'll tell you the natural ingredients and how much is in there, and then I'll tell you additional ingredients, which we call fillers. Okay, so you got to be careful with fillers, because sometimes fillers are not good. That's just that. They're just filling in. But do you really need it? No. Some of those fillers can be toxic. So just think about it. You're trying to do a cleanse, but some of the fillers can be toxic. So it's like an oxymoron. So why even do it? But anyway, there are some cleansings or cleansers out there that you can use that will not have you strapped to the toilet, okay? But and then and if you want to know what they are and what they are, you can get in touch with us at www.bw-center.com/mm for Medical Monday. I think probably what we probably still have posted is from the last show last week, but you can still go there and look at that, or go to www.bw-center.com, which is our calls. Yes, I do talk to you. Hey, Tanisa, thank you for joining. Please like, invite, and share as you come on, Tanisa.